Hi, I'm Maiki and today I'm going to talk about motor skills and BOT2 test that we are using in our clinic to identify motor developmental delays. So first of all, let's talk about motor milestones. So motor milestones are a useful way of monitoring a child's development. Motor milestones are normal and typical development of the child. And it must be remembered that each child is different and will achieve milestones at a different rate. So when we're talking about milestones, I mean, for example, an infant is starting to hold their head, or when they start to turn or crawl, and with older children, when they start to walk, running, using stairs. And so milestones are useful for us to identify delays in motor development. And when we're talking about motor skills, we are talking about fine and gross motor skills. Fine motor skills are the group of skills that involve ability to manipulate small objects with the hands and fingers. So, for example, grasping, holding, or pinching. And gross motor skills are those which require whole body movement and which involve the large muscle groups such as jumping, running, walking. And early assessment for the development of motor skills is particularly important to monitor changes in or deficits. Skills can cause problems in their psychological and social development, and also are linked with various health outcomes like self-esteem, cardiorespiratory fitness, cognition, and, for example, overweight. And it's really important to identify those delays in motor development, so targeted interventions can be carried out. And how can you, as a parent or caregiver or teacher, identify delays in motor development? There are some symptoms to be aware of. For example, when the child cannot keep up with their friends or classmates at the same age. When the child is clumsy, dropping or bumping into objects. When she's slow or the movements are inaccurate. For example, when throwing a ball, but the movement to catch the ball is too late. Child seems weak or movements are stiff. So these are like most common things that parents or teachers are mentioning. In our clinic, we use BOT2 assessment to identify delays in motor development. The BOT2 is an individually administered measurement, and it measures fine and gross motor skills, and it is for kids age 4 to 21 years old. And this is a fun way to measure their development. BOT2 evaluates 4 areas. First one is fine manual control. This is filling in shapes, for example, drawing the lines, folding, cutting, copying square or circle. The other one is manual coordination. This one is transferring pennies, placing pegs into a pegboard, sorting cards, stringing blocks, dropping and catching a ball, dribbling a ball, and throwing a ball. The third one is body coordination. Touching nose with the index finger, for example, jumping jacks. Also key is doing different kind of tapping exercises, tapping with the feet or fingers, and different kind of exercises with to check the balance, like walking on a line, standing on one leg, standing on balance beam. And the fourth category that we are evaluating is strength and agility. So there the key is doing, for example, shuttle run, one leg hopping, two leg hopping, standing long jumps, sit-ups, wall sits, push-ups. And so after we do this test, we can interpret the test results and we can identify in which age range the motor skills are. So this is the test that we are using in our clinic, and it is a really fun way for a child to assess the motor development, as the child is doing just different fun activities. And after that, we can just tailor the treatment accordingly to the test results. So, thank you for watching, and bye.